Community health centers have access to primary care medical needs, acute care medical needs. There's a dentist available, and then behavioral health, and then also, psychiatry and the actual therapy is also available at those services. Telehealth technology is being used to provide access to patients so that they can be seen by not physically coming into the clinic and being seen at either home or through their school, but anything through video or telephone. Once COVID hit, it was really apparent that we needed some way to continue to see patients, and it was not safe to see them in person, and still in a lot of cases is not. That's when telehealth really kind of became useful in seeing that it provided so much access to people who couldn't come in face to face. Telehealth has improved the overall health and access to the clients in that we can see a lot more people. It's a lot more convenient. If you're not feeling well, or if you have any sort of symptoms and you don't want to come into the clinic, you can still have your visit instead of, having to reschedule 3 months out. It allows people that have to drive from rural areas or, miss school or work. It allows them to have a faster appointment without all the driving and the extra cost of, getting out of work or school and having to pay for gas, or, in some cases people travel as far as, maybe 4 hours away where they have to come, stay the night, and then be seen. Well, a lot of the patients that we see, because there's so many rural communities around us, we see patients as far as 100, 200 miles away where, when they have to come in just to get their stimulant medication refilled or tell me that they're doing okay, and maybe there's nothing additionally, they just want to stay on the same meds, to drive that far in just for me to say, okay, things are going good, and renew their meds is a huge time suck and a huge cost to the patient. A lot of the medications need to be seen every 3 months, before we can refill them. So it's important that these people get in and to be seen. And this allows that to happen more routinely than having to come in site for a visit. Community health services provides access to about 95% patients with Medicaid, meaning, lower income status. And for those people, they a lot of times don't have access to transportation, or they can't miss work, or they have multiple children at home that would need to bring into the clinic. We also see, foster kids that, are moved from house to house, and maybe the foster parent can't bring them in. We see children or adults through juvenile detention centers or jails that they're able to come over the computer and be seen instead of, having to go into the jail and go to these different areas to be seen. So it provides access to that. We can see people in skilled nursing facilities or people with intellectual delay that live in a group home. We can see them with the nurse on the visit instead of having to take that nurse or that provider to come bring the patient in. I think that telehealth helps in a lot of ways for people who, especially children who don't want to be embarrassed or the stigma of coming into a mental health facility. It keeps it more private. It also allows people from the juvenile detention centers, maybe, it's embarrassing to come in if you have to be handcuffed or in different clothing than everybody else. So it kind of takes away that stigma of being seen in mental health physically. People a lot of times are worried about even coming in the doors because if they see somebody they know, people know you're getting help for mental health. If the pandemic was done tomorrow, I would absolutely still use telehealth because of that access, because of the convenience. I think telehealth in the future is going to be so important. It's going to continue to provide so much access to people who normally cannot be seen or, takes hours to drive here, or they're too concerned about the stigma of mental health. I think it's going to provide so much of that ability to open up services to so many other people that normally couldn't be seen in person.